Now that you have validated your clinical need, you can begin thinking about your design. The purpose of this unit is to introduce you to the concept of design thinking with specific application to medical device design. In thinking about a design, our approach will draw inspiration from Genrich Altshullter, the Russian inventor and innovator who developed the theory of inventive problem solving and who analyzed over 200,000 patents to identify his 40 principles of innovation. To begin, let's think about the problem we are looking to solve and summarize it in a short statement. The statement should be clear and unambiguous. Use simple language and avoid technical terms. Keep in mind that it should be understood by non-experts in any particular sector. Avoid jargon which is not understood by people outside a specific domain. And, most importantly, make it brief. As an example, consider the problem faced by the anaesthetist in administering epidural anesthesia for pain relief. The clinical problem involves identifying the narrow epidural pocket between the muscle layers and, at all costs, to avoid puncturing the dura space. In practice, there is a small loss of resistance as the needle is advanced through the fatty tissue into the epidural space, and it is this loss of resistance which is used to indicate correct placement. However, this loss of resistance is difficult to detect, more difficult to teach, and, when incorrectly administered, can have significant clinical complications. Therefore, as an example, the clinical problem could be summarized as to reliably and safely detect the loss of resistance on epidural needle placement. Having clearly stated the problem, our next step is to describe the ideal solution. It's important to understand that this is not the system which describes the solution, but rather the function which the solution performs. It may be helpful to think of the ideality statement using Leonardo da Vinci's approach. Think of the end before the beginning. That is, look ahead to the function which will be performed by the ideal solution. Again, returning to our epidural needle placement problem, this might be captured in the statement: the needle tip reaches the epidural space safely and reliably without breaching the dura. It's important that, while the problem statement is a proposition, that is to say, something to be done, the ideality statement is an action or outcome. One of your tasks in this unit is to create an ideality statement for your proposed solution. At this stage, it's perfectly acceptable to start thinking of solutions to your clinical need, either as a team or individually. In imagining the ideal final solution, it's important at this early stage to think like a child. Don't worry yet about physical or material constraints. The point here is to idealize what the ideal solution should do rather than solving all the secondary problems. Catalogue your solutions either as a team or individually, and we will return to these. These solutions can be as harebrained or crazy as you like for now, and we will call these your ideal final result. As an example, in the problem of epidural needle placement, the ideal final result, which be to administer epidural without needles or to use self-driving needles which stop at the epidural space. Next, we will list the resources which are available to us in solving this problem. These represent the resources already available rather than those we introduce. As an example, consider a wire carrying an electrical current. While some of the resources are obvious, some are perhaps not so obvious. For example, the contaminants in the copper wiring. The resources listed here are all primary resources. That is, they already exist without us doing anything. However, there are resources which we can derive based on the primary resources of the system. In an electrical wire, many of these are electrical measurements, but all systems should have primary and secondary resources. In the epidural needle problem, primary resources include the skin, the tissue, the fat, the patient, the anaesthetist, and the environment of air and tissue around the space. Secondary resources might be the drop in pressure, which the anaesthetist feels on entry into the epidural space. We can think of resources in different ways. Time and space are obvious resources, as well as the substances or materials of the system. However, the function of the system, for example, the patient's sweaty skin or associated fields, such as the nerve's action potential difference, might be resources that we overlook. Also, there may be information available with the help of fields and their interaction with matter, such as a compass needle that turns to north in a magnetic field. Another outcome of this unit would be for you to list all the primary and secondary resources in your system. Resources arrive from unexpected places, and we need to be able to identify them. So, let's summarize your outcomes from this unit. Having identified your clinical need, you first will look to create a problem statement, which briefly and succinctly states that clinical need. Next, define an ideality statement which captures the ideal solution. Then, begin a list of idealized final results. This list will continually increase, but you need to get started as soon as possible. And finally, list all of the resources in your system which are available to create your final solution. Next time, we will look to use all these resources to solve your problem.